Hi, I'm Dr. Katie Berlin. Welcome to this special edition of the Veterinary Breakroom, where we talk about relevant topics in vet med today. And I am joined by a special guest today, Dr. Liz Barton. Welcome to the Breakroom.
Thank you so much for having me. Yeah, excited to have this conversation.
Me too. I feel like you and I have been waiting to have this conversation, and now we finally get to do it. So I'm very excited to jump in. But first, would you mind just giving our listeners a little bit of background on who you are and how you came to be here today?
Yeah, sure. So I am a veterinary surgeon from the UK, if you can tell by the voice. I graduated in 2004 from the University of Cambridge, and I actually had a really enjoyable, varied clinical career. So I did mixed practice, a small animal internship, ECC night work, shelter medicine, regular GP practice, all sorts of things. But it was sort of around the 20 teens that I became increasingly challenged, I guess, about the well-being challenges facing the profession, and really wanted to help and support and do something about it. And it was also the time that I was a parent, so I've got two young girls who are now 10 and 12 years old, and just the real challenges around being a parent and a professional. So around this time, I set up WellVet, which is a not-for-profit initiative, which was to collate and curate wellbeing resources and hosting in-person and virtual events. And I also set up the Vet Mums Facebook group, so similar to the moms with the DVM, I think it is, that you have in the US, which now has about 9,000 members to discuss the challenges of parenting in the profession. And all of this sort of snowballed really into speaking at events about wellness and parenting topics, and it led to several sort of roles within veterinary organisations and boards. So I sat on the Society of Practicing Veterinary Surgeons as their wellbeing representative. And for a period, I was also the editor of the Veterinary Women platform. And then it was really through both of those that we started looking at women's health issues within the profession. And we sort of covered everything from, the challenges and impacts of breast cancer, infertility, baby loss, endometriosis, and menopause was one of the topics that we covered then, and that was really the first sort of time that I had my eyes opened to the menopause conversation, and really wanted to dive into it a bit more. And through a WellVet virtual event that we actually hosted just after the first COVID lockdown in the UK. It was May 2020, and we had this virtual networking platform, and it was when it was all kind of new and shiny. People hadn't really done virtual networking before. So we invited people to just network and have conversations about anything they wanted to, really, on this sort of day-long virtual conference. And a group of women just started talking about menopause, and they sort of came back to us and said, how powerful that had been for them, the first time they'd really been able to discuss it with veterinary peers. And they really wanted to do more and to take the conversation further. So off the back of that event, there was this very sort of clear mandate to do some investigation about the impacts. So we actually hosted a survey and then produced the Veterinary Women and SPIV's menopause report in 2020, later on that year. And being premenopausal at that stage, not having had any prior real knowledge of it, other than, my mum was a bit grumpy and didn't want to talk about it when I was a teenager, it just highlighted that this problem really is quite huge. And since then, I've just really wanted to know more, do more, provide some solutions, and get some more in-depth research to really understand how we can do better for our veterinary team members who are impacted by this.
It's so powerful just to have a conversation about something that I don't think I ever had a conversation about before very recently. And I like how you sort of phrased this as the biggest silent health crisis in veterinary medicine. And I was thinking about that, if we're lucky, half of the human population is going to go through this. And certainly in veterinary medicine, it's a lot more than half, given how woman-dominated the field is. And I feel like if there was a condition that was affecting our patients, over half of our patients, sometimes very significantly, causing behavior changes that disrupt sleep and eating and all the schedules that we sort of depend on to be stable. Our pet's personality change. If we had over half of our patients were going to go through that health change, we would be talking about it we'd be doing everything we can to learn about it and to talk about how we can get through it and support these pets' families through it. And yet that is exactly what's happening to us, and no one wants to talk about it. And I feel like as a society, things are changing when it comes to women's health, but we still have a really hard time talking about menopause. Why do you think that is?
I think there was a phrase that I heard in a podcast which I think summed it up brilliantly. There's this culture of acceptance of women's suffering. And I think that doesn't just apply to menopause. I think that applies to challenges around menstruation, endometriosis, other health problems, because they're linked to our physiology, to our hormones. And therefore, I think there's almost this belief for ourselves as well as women, but also in wider society, that therefore we should put up and shut up. I mean, menopause in particular, if you think back to the sort of Stone Age times when we were, in that evolutionary period, we wouldn't really live beyond 40. So, I don't think our bodies are necessarily adapted, I don't think we've evolved to go through menopause, and therefore the changes on our body are so significant, and we shouldn't just be sitting back and accepting them. I mean, we say it's going to affect 50% of the population, i.e. females that go through the full lifespan. That's 2/3 of the veterinary population affected directly. And, as we have more and more women coming into the profession, that percentage is only going to go up. We know it causes psychological and physical symptoms in 75% of those. We know those symptoms can be severe in 1/3 to 1/2. We know that it's causing 1/3 of people to reduce their hours, to step away from leadership roles, to maybe move out of large animal practice, or to give up work altogether. And we know that in 100%, so even the 25% for whom there's no sort of negative symptoms necessarily, there is this sort of asymptomatic change in our bodies, which increases significantly the risk of cardiovascular disease, stroke, urinary tract infections, bone fractures, muscle wastage. It's just absolutely crazy that this is underfunded, it's not discussed, it's ignored. There's underdiagnosis, there's misdiagnosis, there's lack of treatment. It's just crazy that we're not doing more, for the health of the individuals, for society, and for the profession. It's it just is bonkers.
Yeah, those stats you were talking about, from the survey that you did, you said 42% of women said they had considered leaving their job because of menopause, or for reasons related to menopause, and 12% resigned from their jobs. I mean, this is a retention issue. It's a retention crisis that is compiled on top of the other issues that we're having with retention in the profession. And I think in a conversation that we had before, you said you were talking about the fact that women, past a certain point in their career, are potentially the best mentors, the best role models for sort of younger and up and coming women in the profession, and they're not there because of this reason. And so doing more to support women through menopause seems like a no-brainer to me, that if we know this is happening, we have to do a better job of helping to keep these women in the profession if they want to stay.
Yeah, absolutely. And I mean, some of those stats you quoted out, I think, were from the introduction to some resources we've put on the WellVet website. There's free
Yeah.
access resources, and some of them are across industry because there's not actually not that much data from veterinary. But if you look at some of the cross industry, statistics, there's a recent study by the Mayo Clinic that estimated that the US economy is conservatively losing more than $26 billion annually due to the failure to address the effect of menopause on working women.
Wow.
And it's considering that figure, that's bearing in mind that menopause is underreported by individuals, it's underdiagnosed and it's undertreated. So we can guess that estimate is a massive underestimate as well. But proportionately in our profession, because we are more than 50% female, think how much more that's potentially impacting the veterinary profession. And as you've alluded to, it's a time in our careers when we are quite experienced. We've cut our teeth, we're more confident clinically in our abilities, and potentially we can provide that mentorship and support for younger people. It's also a time in our careers when maybe our caring responsibilities have reduced. It's sort of between the ages of 45 and 55 when people typically experience symptoms related to perimenopause. And so this is a time where we really should be sort of rejuvenating our careers potentially. So it's a really, really key time where we could be doing a lot more to support people in the workplace. And as you say, sort of have that double benefit of retaining the experience and the people that could mentor younger vets as well.
Yeah, so let's talk about those resources because you're working really hard to do exactly that. And with some partners, you've produced at least the first round of resources on the WellVet site to help provide a little bit more support for people around menopause. Can you talk about the resources and the partners that you worked with to make them?
Yeah, and this is something that I've been working towards really for a couple of years. Ever since publishing the menopause report, I'd really wanted to actually do something about it. And it's taken me, much longer, as these things always do, because I sort of squeeze it into my my non-working hours and my non-family hours.
You're one of those people that you're like, I'll sleep when I'm dead.
Yeah, exactly.
Yeah.
Yeah. Burning the midnight oil, editing menopause videos. Yeah. So I spent a while sort of researching things that are needed and looking at cross-industry resources. And really it's tricky to sort of retrofit anything to veterinary practice because we are quite unique. There's sort of challenges that we face. It can be quite a physical job. It's very intense. You have to be very professional. You have to be very caring and compassionate. The hours are challenging. So, and, the sort of demographic of individuals, high achieving perfectionists, etc. So it does make it, sort of general resources don't necessarily always fit into, for example, ambulatory equine practice. So I'd wanted to commission something that's very specific to veterinary. And I've been very fortunate to work with experts. So Dr. Claire Gilvray, who is a human physician who's got expertise in mental health and also women's health. So she's done a whole series around the pillars of lifestyle medicine. So these adjustments that we can make to everything from our sleep, our diet, our movement, our social relationships, avoiding things that are bad for us. So these pillars that you can sort of make incremental changes to improve, particularly the symptoms around perimenopause. And then Dr. Chloe Hannigan, who is a veterinary surgeon, but also a qualified yoga instructor. And she does a lot around managing her own endometriosis symptoms and menstruation symptoms with forms of yoga and meditation and breath work. So she's done a whole series which apply, as I say, not only to menopause, but can be applicable throughout, those sort of challenging hormonal cycles. And then finally, Dr. Libby Kemkeran, who is a neuropsychologist and a veterinary surgeon. And she's done a great series on actually the sort of neurophysiology of our brains, where the hormones act, how those change during perimenopause period, how our individual brains are wired slightly differently, and how those changing hormones can actually impact different people in different ways. So just empowering people with that understanding of what's going on, what they can do about it. And what I really wanted to sort of emphasize is to make these videos quite short and bite-sized, but to make them super practical as well. So there's very practical tips that people can do, even in the consult room, even like a 2-minute breathing exercise that can help to reduce something like a hot flush, or, help to bring back concentration and boost confidence, things like that. But also to empower other people who are not necessarily impacted. So those women who maybe don't have symptoms, or, our partners, our colleagues, our friends, maybe they're younger women who aren't going through menopause. Maybe they're our male partners or our male bosses or our, sons or our brothers, who actually really want to support their partners and their colleagues, their employees. So it really is for everybody, within the veterinary team, not just for the women, not just for the people impacted. Obviously this applies to veterinary nurses and receptionists and managers across the board. So very hopefully accessible, very applicable, and very practical as well.
Well, I think you've definitely achieved that with the ones that are on the site now. I actually went to a coffee shop and just sat there with my headphones on and watched a whole bunch of them. And we'll get a little bit more personal here in a minute, but I felt very seen by what I was seeing and hearing, and just having my fears about menopause acknowledged, validated, and then sort of alleviated just by somebody saying like, hey, there is a lot you can do. I have a medical history where I can't take estrogen anymore. So no hormones for me. And so I am not in menopause yet, not experiencing symptoms yet. And I'm staring down the barrel of what feels like a very scary time without the ability to take hormones. And I love the balanced approach of the resources where they say, okay, it's not just throw hormones at the problem and it goes away. A, that doesn't happen. And B, the number of symptoms, the type of symptoms seem like they can be so varied that you really have to take a multimodal approach, a more holistic approach to what you're going to encounter, and then also when you're supporting people who are experiencing symptoms. And that is the other part that I love, is that these are digestible things that we could just send to someone, a partner, a coworker, a manager, and say, hey, can you take a look at this, because this is what I'm going through, and it's like my brain is literally changing right now, and I'm not maybe getting what I need, or I'm feeling a little bit at loose ends where I used to be very comfortable, and maybe we can work together to figure out what the best way is to accommodate that and support me. And I think that is super empowering. So, that goal, you are achieving it for sure, as far as I can see.
Yeah, it's really great to hear that. I think for myself, as I was sort of compiling these and talking to the providers about the content, I've actually had a sort of year of discovery, if you like, of my own journey through perimenopause. So I actually started researching and writing the menopause report before I'd experienced any symptoms at all. And yes, it was kind of worrying, but it was also empowering, because it was like, okay, knowledge is power, right? And through these resources, I want people to be educated. So, they've got that awareness there. They know what to look out for. And then empowered to have the conversation, be that with their physician, be that with their partner, or their colleagues at work, their line managers at work, for example, and then be motivated to take action either for ourselves or for others, to actually make some changes that can improve our health. And this is cumulative change, right? It you build these things into your life. The average sort of period of perimenopause, as I say, is between the ages of 45 and 55, whereas menopause is sort of one defined date that falls approximately halfway through the middle of that. Actually, the symptomatic period can be, a decade and beyond, even if we don't actually manage the symptoms well. Yeah, exactly. And, it could actually be like a third of our life. It's crazy that we don't sort of prioritize it more, and then also like equipping people to make those changes, and by sort of looking at all of these different areas. And again, it's not just giving ourselves a list of, you've got to eat healthy, sleep healthy, not drink, not smoke, right, not be fun, it's about like just small habitual changes across different areas that we can build in and then build on, which then together make bigger changes so that we are better psychologically, physically, emotionally. The emotional side is huge, our hair falling out, our skin going dry, our boobs shrinking, our body changing, our muscles weakening, we can actually, there's a real sort of identity piece here. Our sense of identity can change as well. I mean, I'm sitting here fiddling with my hair because my hair is so thin now, I can't bear it. But there are so many areas of our lives that it impacts, and there are lots of then little things that we can do to help counteract those impacts. So I've gone through this year of discovery where I've made lots of small changes in my own life. So sleeping better, changing the way I exercise, because what worked in my 20s and 30s doesn't actually work for me in my 40s. It was just making me tireder and tireder and, less and less fit. So I've changed lots of little things across lots of areas. And I've also then been able to track my symptoms so that when I did speak to a medical professional, I could say, I've got all of these things together. And rather than just sort of waiting until the sort of almost the straw that breaks the camel's back, which quite often for people can be things like crippling insomnia or crippling anxiety, and then they go with that one symptom, and then maybe they get treatment for that one symptom. So maybe they get something to help them sleep better, or maybe they get antidepressants, and it's like a blunt tool to treat one symptom. Whereas if you actually went and said, I've noticed that my hair's sort of falling out, that I've got anxiety, but I'm perhaps not sleeping as well, and I'm having hot flushes, and my joints are quite achy, and once you sort of start adding up your symptoms all together, instead of just being handed one blunt instrument for the sort of one of the symptoms, then the medical professional is able to say, actually, we should be treating all of these things together and treating the underlying cause, rather than, just sort of focusing on the thing that sort of pushes us over the edge, if you like. So we could be doing so much more just by having that awareness and empowering ourselves to understand that these symptoms are all related, and that stuff can be done about them.
Yeah, when you're talking about that, I'm thinking about, like, what if this was a patient of ours and, it was a dog with Cushing's that the owner, didn't call when the pet was panting and gaining weight and eating everything in the house and drinking 85 bowls of water a day, but, and their hair is falling out. But then they come in because the dog it seems to be incontinent and is peeing all over the house. And they're like, I want my dog treated for incontinence. Because the incontinence is not something I can live with. We wouldn't just throw an incontinence medication at that dog. We'd do a full workup and we'd say, okay, there's an underlying cause and there are many things that we need to be doing differently here. And we do have a tendency to do that with ourselves. It's just like put it off until we can't put it off anymore, and then want that problem gone now with a pill or whatever. And it just doesn't work that way with menopause, unfortunately. It would be really nice if there was a pill to just make menopause symptoms go away. But apparently there isn't.
The old magic pill that we want for every condition.
Yeah. I would like, if you don't mind, to go through a couple of definitions, because we hear the terms menopause, perimenopause, premenopause, early menopause. We hear these terms kind of bandied about, and I don't actually know the difference between all of them. Would you mind just enlightening us a little bit?
Yeah, sure. So menopause should probably be called menostop. So it's basically the point 1 year after you have had your last menstrual cycle. So that is defined as menopause. It is a day in your life that, is a year after. The perimenopause is typically the period around that, the decade normally around 45 to 55, where the average age of menopause itself is 51, where people experience symptoms that are related to fluctuations in those hormonal levels. So our hormones don't do this really nice linear decline. They sort of just go a bit crazy. So sort of up and down and round, and, yes, they decrease over time, our estrogen and progesterone and our testosterone as well, actually, but not in any way that is predictable. So it can be things like lighter periods, heavier periods, irregular periods, and then all this plethora of symptoms, because there are estrogen, progesterone, testosterone receptors all over our body, and therefore they can affect pretty much any body system in a variable way, both within and between individuals. So up to 75 symptoms have actually been recorded. I mean, I had itchy ears once, and that apparently is also related. So
no way.
Pretty much any weird thing that happens to your body in that period is probably due to some kind of hormonal derangement. So as I say, some of these symptoms we will experience, very physically or psychologically. Some of them will be sort of asymptomatic, but they're still happening. Things like the osteoporosis, the bone weakening, the muscle wastage, etc., the dryness of the skin, etc. We may not sort of be necessarily conscious of that, but it is all happening. The increased likelihood of urinary tract infections, all that sort of thing. Early menopause is menopause happening earlier than the average, and that can sometimes be due to sort of medically or surgically induced menopause. Obviously we're talking about people who have ovaries and a uterus, so if you have to have medical or surgical intervention there, then obviously there can be early menopause there as well. So some of the most poignant responses we had to the menopause survey were from people who'd had early menopause in their mid-20s, where they'd have to have an ovarian hysterectomy, for example, and just felt completely unable, all of a sudden are plunged into menopause, and just really struggling to find support within the workplace, but also within the home, and how to have those conversations. So we do need to be mindful that we don't just sort of box everybody up and say, okay, everyone in that decade of 45 to 55, they're going to be, quotes, perimenopausal, and therefore they're going to need these sorts of interventions, and we're going to need to have that conversation with them, and we'll let our unconscious bias just bubble away in the background, so we'll overlook them for promotions and things. What we don't want to do by having this conversation is have any sort of negative gendered ageism, as a maybe conscious or unconsciously. So we've all got to be mindful of that, but also, not take a sort of general approach. This is very much about having conversations with individuals, and as I say, it can vary for that individual as well. So my symptoms vary wildly, and sometimes air temperature control would be helpful, other times maybe a bit of break and flexibility would be more helpful. So we just have to be mindful of, whilst we're talking about menopause, and that's a great thing, we really should be empowering people that we're not having any sort of negative consequences from boxing everybody up under this menopause umbrella.
Yeah, that is a really good point. And before I say what I was just about to say, I think you had said we're talking about people with ovaries and uteruses, and I should have said this at the beginning, but the terminology we're using is women's health, women's bodies, women going through menopause. Really, we mean people with uteruses. And so, that encompasses all genders who are actually in possession of a uterus and ovaries, because they're going to go through this change. And so making assumptions about people and people's biology is obviously something that we want to avoid in general anyway. But you had said, there's definitely, it's kind of the old school, like, oh, well, she's on her period, so don't mess with her. Or like, oh, you're so grouchy today. Like, are you on your period? And we've at least realized that I think most of us have realized that that's really not cool to do. But it is definitely a raw area to suddenly say, well, okay, hormones could be responsible for like literally anything that's happening to me during this period. But I don't want people to just be like, oh, it's your hormones, oh, your hormones are going crazy, because it sounds dismissive there and it makes it seem like we are not still whole people who, are in charge and responsible and able to do our jobs. We just need some different support.
Yeah, exactly. It's another form of microaggression, sort of,
Yeah.
oh, having a hot flush, are you? Or a bit
Right.
brain foggy today, are you a bit forgetful? Actually, it can be like really crippling and crushing for our confidence to have that. Whereas having the right support in place, we know is so empowering. So part of this is about that culture around how we discuss, hormonal health issues, I think, for sure.
Yeah. Well, and ageism too, you had mentioned a little bit ago. Because as you're talking about this, I'm thinking about how just absolutely youth centric our culture still is. And especially for women, when you get to a certain age, it's really unfair because we spend so long trying to become confident in our own skin and in who we are and in our strengths and shortcomings and the things that we need to work on more and the ways that we relate to the world. And I feel like your 40s are really a time where a lot of women are just like, okay, this is who I am. And I have, a lot less apology for the things that I'm not or the way that you want me to be that I don't want to be. And we get that confidence coming into our 40s and saying, like, I know who I am and this is great. And then all of a sudden our brain literally changes. And which I want to talk about more in a second. But and then suddenly you're like, I don't recognize myself. And you had this big spike in confidence and you feel so good about, this is something that I own. This is me. And then everything you thought you knew about yourself just kind of can change, sometimes seemingly overnight. And that can really change how you feel other people perceive you too, and really deal a blow to that confidence. Can I ask you personally, did you feel that shift happen?
Yeah, I think just as you were talking there, my mind went to that movie Inside Out. I don't know if you've seen it, but it's
I
like
haven't. I need to.
It's kind of inside this teenager's brain, Inside Out too. There's this like little control panel of her emotions, and she goes through puberty, and then she gets an upgrade to her console in her brain, and all these other emotions that she never had before when she was younger. Some of the more complex emotions around anxiety, jealousy, etc., come in, and so she's got this much. And I sort of feel like you say, you just get used to this kind of upgraded console with all of these complex emotions when you get to about your 40s. And also you've been investing so much in kind of building a career, caring for others, looking after other animals, looking after our clients, looking after our families. You sort of have a bit of breathing space to go, I have arrived and I think I've actually got a bit of capacity to do something for me and be me and invest a bit more in me. And it feels like someone gets with this sledgehammer and just starts smashing up the console, and it's like bits of emotions flying all over the place. So, and I don't know if they'll make an Inside Out 3 just for me, based on that, but I wish they would. I mean, I experienced, first of all, we're talking about that sense of identity and my hair falling out, etc. And that, the kind of confidence that I had around some sort of athletic performance. I'm no top athlete or anything, but I was, a decent runner, decent cyclist, etc. And those things were just slipping away a bit. I was training harder and going slower. I was lifting heavier and feeling weaker. Just and then, sort of my appearance was changing, all the aging things that happen, the skin changes and the hair changes, the bodily changes. And then the whole sort of confidence piece, I work in communications. I'm the sort of head of communications for a global veterinary company. And I sort of couldn't finish the end of my sentences. And I'd be in meetings and I'd I'd sort of have this thing that I really wanted to say, and then I found myself like not saying it because I was frightened that I couldn't trust what came out of my mouth because there was some disconnect happening, and it just felt completely like the rug was taken out from under me. So a huge sort of knock to the confidence. And then, just sort of feeling fatigue because I wasn't getting as much sleep, which impacts pretty much every area of our lives. So you do feel quite vulnerable as well through some of this, and really irritated as well. You just feel like you deserve a bit of a break.
It's not fair.
It's not fair. So but I like I say, I was empowered with the understanding of I knew what this was, and I knew there were things that I could do about it. And yes, it took me a good year to work through all of the different areas and pillars. And I would say to anyone, when you're approaching this and you come on, at the moment there's 9 videos on the website, but I spent my weekend editing the next batch. There's going to be 26 videos in total. I'm not for 1 minute suggesting you should sit there and watch them beginning to end and try and implement all of them, because you will just get lost. I think you pick the 1 or 2 things that are most important and most doable for you. You work through those, and then, once you've sort of built what you need around that, then you move on to the next thing, and it'll change as symptoms wax and wane as well. So dip in, dip out as needed, but just know that there is something in there that can help pretty much manage most of the symptoms in some way or other. So like I say, for me, I went through a period, like a 4-month period, where I had a coach to sort of completely change the way I exercised. It was a woman who specialised in cycling for the over 40s, and that changed the way I breathe in exercise. It changed the way I eat around exercise. It changed how I exercise. It changed the intensity. It changed the pattern of exercise, and all of that has meant that I am now getting back to being fitter, healthier, stronger, faster, but less tired at the same time. That's just one example, but for me that's quite a big one, because that's such a big sort of pillar for me of well-being.
Yeah, I love that. I love that there are coaches that will actually focus on that target demographic, who is, as we've said, a very large demographic, but maybe not one that, in your 20s, it seems perfectly normal to reach out to a coach because you want to qualify for the Boston Marathon, or do an Ironman or something. And then in your 40s, you're like, well, do I need a coach? What do I need a coach for? But your entire physiology is changing. So that makes perfect sense. For me, so I've never met a personality test I didn't like. I love that stuff. And the resources that deal with sort of the type of person that you are, and sort of how you see yourself, what your sense of identity it circles around, focuses on, and then the different ways that menopause can affect you if that identity is challenged. That really spoke to me. So the resources by Dr. Libby on the big cat brain, which is the sort of system she's designed to help you figure out what category of person you may fall into most in terms of how your identity might be challenged during menopause. And I am a cheetah. 100% cheetah. Ideas all the time, trouble following through. It's a good thing that there are people around who can do things like budget and have spreadsheets, because I am rubbish at that, but I will always have another idea. But the idea, the concept that I might wake up one day and not even remember my idea, or be able to synthesize into words the idea that I had, and communicate that to the team, as you were saying, communicating is life for me. That's terrifying to me. That is so scary. And then, she was talking about I think the lion is the person who remembers everyone's birthday, and is always cheering people on and telling them to have a good weekend, and sharing some happy music on Slack or whatever. And that for that lion to just not want to talk to someone because they're feeling kind of grouchy that day is totally alien feeling. Whereas for me, that's just Monday. So I think it is so important to think about that as a matter of identity, that this is not just you like having a bad day. This is legitimate changes in your brain that will make you question who you always thought you were. And that is very scary to me, but putting a name to something and saying it out loud and talking to other people who are going through it makes it so much less scary to me. It becomes something that we can work on together and support each other through. And that's power, I think. Do you have a favorite video or favorite resource in the library so far?
Yeah, I think having worked through them all, through the editing process and really sort of absorbing myself in it, I think there's one from each that I would take. So as you're saying, sort of Dr. Libby talking about those different personality types, I also love the way she talks about the sort of phases of womanhood. So maiden to mother to crone. And crone, we talk about, that old crone is now associated with a sort of witchy, aged character, sort of falling apart at the seams. And as a sort of derisory character, whereas actually the origins of that were very much, the word crone is actually crowning. It's supposed to be the crowning age of womanhood. So, formerly it was the kind of village elders, the female elders in the villages that were actually revered, as sort of having that experience and looked up to. And now it's almost flipped, and now sort of maiden is the thing to be, sort of embrace your youth, and it's all about being youthful. So it's that sort of mindset flip that actually we have to come back to honouring that latter stage of our lives, both as ourselves, but also in our societies and communities and workplaces, rather than demeaning it. And then I think on the sort of more medical side of things, so Dr. Claire talks about the sleep session, which she actually goes into cognitive behavioural therapy around sleep, so CBT for sleep, which she's also qualified in. And this is an area that is, I think, so massive. I mean, sleep affects just about everything, and I've listened to some of the podcasts and read the books around sleep that basically says if you don't sleep, everything else will fail.
Right.
You'll get early onset dementia, and you won't be able to perform at work, and you'll act like a drunk person behind the wheel of your car.
Right.
And for an area that I really struggled with, actually having, CBT itself for sleep specifically can make an enormous difference, hormones or not. And I think for me, actually being able to put in those really practical, almost self-coaching things, like redefining my relationship with my bed and how I think about it and how I treat it, and it's not just about sleep hygiene, switch off your screen before bed and read a book, etc. There's a lot more to it than that, and our actually sort of approach and mentality around sleep. So that for me was probably the most empowering one. And then from the sort of yoga and meditation side of things, Dr. Chloe talks through this really nice yin yoga, which is this sort of relaxing yoga, and it's about just relaxing and holding sort of long poses that really help to release tension in the body and the mind. And I've just found that so relaxing and centering and calming. It's a very sort of cooling practice for mind and body. And it's something that, as I say, as somebody that does quite a lot of running and cycling, actually there's so much tightness in my body that I didn't realise. But then just holding these sort of relaxed stretches where you just let your body weight release the tension, and at the same time sort of calming your mind as well. It's actually really I guess powerful, but in a sort of relaxing, calming, powerful way.
That's the kind of power, like for people like you and me, that's a power we're not super acquainted with, I think, by nature. Like you and I both seem to be sort of cardio aficionados, and like I love to strength train, but like, strength training isn't exactly relaxing while you're doing it. It's hard, and you're trying to lift heavier and heavier, and there's usually like loud music playing, when you're doing it, and it's great. It feels awesome. And strength training is great for women as they age. I mean, done appropriately, of course. But then I just, stop and get on with my day. And giving yourself permission and telling yourself that this is self-care, not that strength training comes easy to somebody who really craves that. Running comes easy to somebody who really just can't wait to get out the door. And it does not come easy to me and I suspect has not always too as well, to just sit still. And that is extremely powerful, to see what your body and mind do when you let it just sit still for a second, or maybe 3 minutes.
Yeah, I will admit that when I first set up WellVet, and the idea was people could come and try different well-being tools. So there was like running, cycling, CrossFit, body weight circuits. But then we also had, meditation, breath work, yoga, the more sort of relaxing movement, mindful exercises. And I was like, oh, those are for the people that, can't do the running, cycling, the proper, in inverted commas, exercise. And my goodness, I really... it was a sort of real awakening for me to actually understand the power of that. And now doing both together, each one enhances the other. And absolutely, I can do better with all of my cardio stuff because I am taking the time to rest and relax and stretch and look after my body in more calming ways, which actually definitely benefit my mind equally, if not more, than some of the cardio and lifting stuff. So yeah.
Love that. And it probably makes you I want to say better, but maybe not better, because that implies you weren't good before, but a partner who's easier to live with, a mother who's more understanding, a manager and an employee who shows up as their best self more often. And that's the last thing I'd like to ask you is, obviously all of these things are sort of self-focused that we've really talked about in depth today. But you had mentioned that having a support system around you and making sure that we have resources to share with people who want to support us more is just as important. And I feel like for a partner who's saying, what can I do to help you? That's a lot easier to say, well, here's a video I could share. Here's some information for you. But for a boss, say a management team, a coworker who does not understand or does not seem to want to have that conversation, or even just isn't opening the door for you to have that conversation, is there anything that you can say, any tips you can give for people who might want to open that door and have that conversation with more people who haven't actually expressly invited them to have it?
So sorry, do you mean from the individual approaching their manager or the manager wanting to learn?
Yes. So I think a manager, that's actually a good point, because if you're a manager and you're like, I think this person is going through some changes and I want to support them, but I don't want to be like, hey, I think you're going through menopause, can I help? So that's one angle that I think is important. But I think more commonly, it's probably going to be the individual who says, I need support. I have now realized this is happening to me. I'm getting these resources, but I need my manager to understand why I might need an extra 15-minute break in the middle of the day just to center my brain or get caught up. And maybe not every day, but I'd like to have this conversation with them. How do I start that conversation? I think that's probably going to be a more common situation, at least in my experience.
Yeah, that is a great question. I think if the door is shut, it's going to be for one of two reasons. One is that, somebody wants to open the door, but they just don't necessarily know how, or they've never maybe even thought about it. And I think in that case, maybe presenting people with some of the research, the sort of the menopause report that's out there, that's freely accessible, that's published, and just saying that this is impacting me. If it's impacting me, I can guarantee it's impacting other people. And it'd be really great to have a discussion around what we can do in the workplace. And there are actually some suggestions in that report of specific workplace-based measures. And then basically saying, is this something that we could put in place in the practice? And if that door is open, just sort of having that framework, so a bit of evidence and then some suggestions, and then talking about what that looks like in that practice for the individual and for the practice. And some things may not be possible, but for example, just installing an air temperature control, a unit, just a sort of mobile unit might be all that's needed, or just requesting to be have the consulting room that's nearest the toilet, or to have a few procedures without the heaviest dogs and that sort of thing. So I think if the door would be open, if people had that information, then there are those sort of resources that you can take, to basically help to educate, your practice leadership. I think if the door is shut and is going to stay shut no matter what you say or do, that's more of a culture issue at the practice. And some of this is around adapting our workplaces, not just for menopausal, women. It's also about adapting our workplaces for people with chronic illnesses of other forms or injuries. You make these adjustments for people who are going through this potentially vast array of menopausal symptoms. Actually, you're also making adjustments for people who do have joint pain, or who do have sort of headaches or migraines or whatever it might be. All of us are going to suffer from chronic illness at some point in our lives. It's defined as an illness or injury that lasts for more than 2 weeks, right? So we're all going to have that at some point. And if you make these adjustments within your workplace, then they are sort of applicable across all of those different, people might need flexible working, or they might need help with lifting, not just because of menopause, but because of joint injuries and, other illnesses. And you're just crazy if you don't put those measures in place, because you're not supporting your staff to stay in their role, to work as many hours, to stay in the profession for longer. You're effectively saying, unless you're 100% physically and mentally okay, you can't work here. Or we're not going to make it easy for you to work. Which, absolutely. So if there's a cultural problem in the practice, I would suggest, look for somewhere that is more accommodating, because that practice probably doesn't have a very good lifespan itself.
Yeah, that's a really good point that, accommodations and adjustments for people going through menopause are really no different than accommodations for people who have other conditions that they just need to work differently, sometimes or all the time. And we talk about that a lot more now than we used to, but still not enough. So, making things flexible, adapting to people's needs, so that they have everything that they need to do their best work seems very intuitive, that would be the best way to keep people in the profession and to keep our hospitals staffed. But I know it's not always that straightforward. So hopefully, we'll put a link to the menopause report in the show notes also, because that's such an important resource for people to check out. And as you say, an easier way that they might be able to bring up some of these issues is sort of a global thing, rather than here's what I need, here's what I need you to do for me. It's not ever going to be just you.
Yeah, and there's a really nice little animation that actually I've done with the University of Edinburgh as well, where it's like a 4-minute animation, and it is just the highlights from the menopause report. And, it's sort of specifically directed at line managers within veterinary practice, to help them understand why this is important, why we need to have the conversation. So literally just dropping a link to this little YouTube video might be the just the little nudge that's needed to start that conversation.
Perfect. All right. Well, we'll have those links for everyone. And Liz, is there anything else that you'd like to share with us today before we sign off? I want to be respectful of your time, but I could talk to you about this forever, and probably will on another occasion, because I have so many more questions.
Yeah, thank you. There is so much to say, and I really appreciate you opening the conversation, because the more we talk about it, the easier it is to talk about, I think, across the board. I'm currently editing the final round of videos, so I'm hoping to have those all live for World Menopause Day on the 18th of October this year. So if people want to come in and have a look at the resources now, just know that there's more coming soon. And also, one thing that we're really keen to do is to get some more robust research into the impact specifically in veterinary medicine. So if anyone is particularly, working with large groups of practices and thinks you might want to get your practices involved, or if you're just in an independent practice but you're really keen to understand how this works for you and your team, then please reach out to me. Liz at wellvet.co.uk is my email address, and also anyone that is free and able and willing to sponsor some of the content, because we can only continue to produce it and host it with kind support from sponsors. So if anyone wants to get in touch with me about that as well, that would be hugely appreciated.
Thank you, Liz. And we'll also put your email in the show notes if you'd like, and that way people can easily get in touch with you later if they are listening on the go and couldn't write it down. But I know there's got to be a lot of people who will hear this today and feel like they're a little bit more seen. And if there's one thing that we can accomplish with this conversation, I hope it's that. So, Liz, thank you so much for your time, not just today, but with the incredible amount of work that you've put into this and all of the work that you've done around wellness and well-being in vet med. It's essential work. And as you say, it kind of makes you the unofficial face of menopause in vet med. And that is, I'm really feeling like that is a place of honor that you own. And I'm really just also very privileged to have had this conversation. So thank you.
Oh, thank you so much. I'll take that in the spirit that it's meant. And thank you so much for hosting the conversation.
If you're the face of menopause in vet med, then things are looking pretty good, I think. The future is looking pretty great for women in this profession. So and thank you all for listening. Well, this has been a special extended edition of Veterinary Breakroom with our special guest, Dr. Liz Barton. And again, check out the show notes for all those resources. And we'll catch you next time. Thanks for listening.
Thank you.
Thank you for joining us in the Veterinary Breakroom. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including the video version on YouTube. While you're there, make sure you subscribe, rate, and review. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts, or drop us a line at podcasts@vetmedics.com. Veterinary Breakroom is a VetMedics production, produced by Alexis Ussery and co-hosted by Dr. Alyssa Watson and Dr. Beth Mollison.